Thank you, MRSI, for allowing me to also continue where I was supposed to be here yesterday. And I think it's important that I share the news as well, why I was not able to reach here yesterday. We did 3 heart transplants in a span of 12 hours, and we've created a medical history yesterday. And thus, the entire managing, imagine there are 3 hearts traveling from each corner of the city to one place, and 3 OTs simultaneously. There are doctors, and the set team of doctors are transplanting those hearts. So I think in my lifetime, it's one of the biggest medical achievement that I've seen, and it's been done for the very first time in India. I'm proud of our doctors and clinicians. I think we can all call it out for them. That's many India. And so I'll start with this, and I just want to catch on to the fad and just give some 6-7 prompts and understand how a global product understand what India is about. Because when I was having chat with Mitali in terms of from where do we start, I thought show off bhi ho jayega, and at least koi to mere prompt sunta hai to mujhe kuch output mil jayegi. So just it's a mute, it's a 7 seconds.
Indian communities to bring out the diversity within India and how healthcare needs to understand and build responsible healthy living.
I never put that video, but okay. What I was trying to ask in my prompts were very, very simple in terms of understanding you being a global product. How do you see India, and what do you think? And just imagine the way it has captured. It has captured the entire nuance of what our life is. How many cultures can be seen in that video for 7 seconds? I don't know if you were able to count. There were 9 different cultures shown in those 7 seconds. And the way we do our buying, which is, of course, the street buying is also being visible. So if I set the context saying that many India, yes, many India. So the world has moved, calling us from India versus Bharat to saying it many India. So at MRSI, I want to bring out the point of saying that how we all legends here in terms of market research, and we understand how to divide, dissect an audience. I think we've been doing it demo-wise, demographics, which demos used to be our age being the biggest factor, and have been all taught that way. When I started my career, I was told the age is the most important factor, and then given the tools we had, the age used to be the first one because that was the sizable data to work on. But I'll tell you what, it's not about age anymore. That entire section of targeting should be thrown away. Why? Because it is about community targeting now. What these brands have done very well in terms of segmenting out the communities. It's ageless. It's not that only 20 to 35 is going to have those kind of products. And not just only what we drink, I think what we consume as well. I think Z was talking about this Gen Z content. I'm also watching that content, by the way. But yes, it's about how I embrace a community, not how do I embrace an age factor. So imagine this is a community, very, very north, you're talking about tea. And you move very down south, you're talking about coffee. A very simple way of showcasing communities. This is ageless. So if all of us are talking about how do I see many India, just throw away the age factor of it, and you will be right into communities. And with communities, you will be able to build something so substantial for your products that it will have either the mass or the niche effect that you're looking for. Now, I'll bring in something very, very interesting onto the table. So when we talk about health, many Indias, now you actually divide India into 4 sections. North up, winters, and okay, it stays there, okay, it stays with us here. So north up in winters is the most prone to heart attacks. Okay, from December to Feb, this is the time when North Indians have the highest number of heart attacks. Now, if you come down south, the influencers and the virals happen in June and July. Now when you go from east to west, March is the time when the most number of virals happen. So imagine within our state itself, the health itself changes so much, and there is so many seasonalities that are happening when you're talking about your own health. Thus, there is many India within health itself. So I'll quickly show you that. So this is how we talk to our consumers in different locations. Though we being a national brand, we also talk to them in their own languages. Why? Because the nuances are different. Somebody in Kolkata will have the highest number of gastric and diabetic problems. Of course, we are a diabetic capital of the world. We are the heart attack capital of the world. We are the hypertensive capital of the world, and many more. It's just because we are 1.6, so don't worry. So where I was in terms of looking at the east, which is even the Kolkata, they have the highest number of problems in gastric. They have the highest number of problems in oral care. They have the highest number of problems of diabetic. Why? Because of our eating habits. Thus, when you are looking at silos, you look at, or let's say, understanding the TG, understanding the consumer, look at how the community behavior is, rather than cutting it down from saying that it's 50 plus. This is when you come to the central India. This is Raipur. Raipur, the community works with as close as family. So imagine, it's one of the places where when we go to a hospital, all of us go as a family. So if, let's say, it's about me who's having a disease or an ailment and I have to go visit a doctor, they will come as a family. Even the kids will also come to the hospital. And that's the support. And that's what you need to understand from a community building point of view. And that's what goes on to your communication as well, that I'm with you whenever you are required. So I hope I was able to make at least one point very, very clear, that leave alone the age, leave alone in that demo factor, just work on communities and what is the passion of that particular area. You'll be able to build many Indias very well for your own brands. Thank you so much.
Thank you. Can I request the audience to keep pouring in their questions, please? I hope it is clear that where you need to put the question. In the meantime, there's one question that we'd like to ask is...
I'll charge.
So, how do we avoid flattening difference when we design the programs meant to serve diverse population? So,
No,
if there
I'm
is...
not able to hear.
So, am I audible now?
It's echoing a lot.
Okay. So, how do we avoid flattening differences when we need to design programs meant to serve diverse population?
I think we were also looking at what TVS Credit was also talking about. I love the way they did their research for years, and they've understood NPSs, they understood. What I missed was the product, what product they've launched basis the understanding of those entire research. But coming back to the question in terms of, if I have to reach out to diverse population, I think let's take the conversation from a health point of view itself. It's a question that health is for everyone, it's most personalized, and it looks very, very generic, and it encompasses anyone who's from the birth till the death, and you won't believe that in your entire lifetime, you only do 2 operations. So my LTVs and my frequencies are very, very low, and I want to keep it that way as well for people. But honestly, when you talk about people coming together, and then you say mass, there's one solution or one product will not fit in anyone and everyone for a diverse population. It will not happen. Let's just let it go, and you will have to create your own niches under that. So imagine, I'll talk about health. When I talk about health, I'll give you an example. Kolkata, a diabetic clinic will work out very, very well for me, but it's a universal problem, right? So diverse, if the solution is diverse, sorry, the population or the product that you are trying to build for diverse people, you will still need to figure out niches in that. It won't work out, one solution won't work out for everyone.
Thank you so much. That's all we have for now.